Welcome to Dr. Joe, a medical program where we discuss various health issues affecting humanity. Today, we're going to be focusing on prostate cancer. What exactly is prostate cancer? Who gets prostate cancer? How does it affect those who get prostate cancer? Prostate cancer is cancer of the prostate gland. The prostate gland is an organ that is found only in men. That means prostate cancer only affects men, that is males only. It's an organ that is found just below the bladder, just beneath the urethra, just beneath the bladder. Through it passes the urethra. The urethra is the tube that transmits urine from the bladder through the penis out to outside. So the prostate gland is situated just underneath the bladder. So this means that most of the symptoms that are going to be discussing pertaining to prostate cancer are going to be urinal related symptoms. The function of the prostate gland is to release what is called seminal fluid. Seminal fluid is part of the fluid that is ejaculated during sexual intercourse as semen. So the function of the prostate is to release food that is eaten that is utilized by the sperms as they go through the vagina into the uterus to go and fertilize the egg. So that is the main function of the prostate gland. In terms of prevalence, the prostate cancer was seen to affect 1.1 million people in 2014. And in terms of mortality, it kills approximately 307,000 people annually, according to 2014 studies. So this is quite significant. If you look at the number of people that actually die from prostate cancer, it's quite significant. 307,000 people annually is quite significant. So it's very important for us to have some kind of awareness and some kind of screening to prevent the spread or to prevent the effects of prostate cancer. The causes of prostate cancer are generally not known. There are factors that we think contribute towards prostate cancer, and there are what are called risk factors of prostate cancer. One, definitely if you are male, there is a probability of you suffering from prostate cancer. Two, it's hereditary. If there is a family history of prostate cancer, a father, a brother who suffered from prostate cancer, your chance of suffering from prostate cancer also increase. Say your father or your brother has had prostate cancer, it means you've got more than double the chances of suffering from prostate cancer compared to someone who doesn't have a family member who suffered from prostate cancer. If you've got two immediate family members, say you've got both a brother and a father who suffered from prostate cancer, your chances of suffering from prostate cancer actually increase fivefold compared to someone who doesn't have a family history of prostate cancer. So that's one of the main risk factors. Then the other risk factor is age. If you are now above 50 years of age and you are male, your chance of suffering from prostate cancer increase. Generally, we say it's highly unlikely for someone to suffer from prostate cancer before the age of 45. So those are the main risk factors of prostate cancer. There are other soft risk factors that are not really proven scientifically that are spoken about. Things like eating a lot of beef, things like sexually transmitted infections. These are postulations. There are no evidence to prove that if you eat a lot of beef or less vegetables, less legumes, your chances of suffering from prostate cancer actually increase. It's just a postulation. For now, let's take a short break and come back and discuss the etiology and the symptoms of prostate cancer. Welcome back to Dr. Joe. Today we're discussing prostate cancer. We've talked about what exactly is prostate cancer. We've tried and locate the prostate gland, and we've also talked about the functions of the prostate gland and the risk factors of developing prostate cancer. Now, let's look at the signs and symptoms of someone who's suffering from prostate cancer. As we said, the symptoms are mainly urinary symptoms. One, you've got what is called hesitancy. Hesitancy is whereby you want to go to the toilet, but the urine is not coming out as soon as you get to the urinal. You stand there for minutes or even a bit of time before the urine starts coming out. That is called hesitance. Two, you've got what is called a poor stream. A poor stream means when you stand in front of the urinal, your urine is not hitting the wall. That's a poor stream. Your urine is just dropping just in front of you. We call that a poor stream. Three, you've got what is called dribbling. Dribbling means when you finish urinating, your urine doesn't come to an end immediately. It remains. You've got something that's called residual urine remaining in your bladder. When you've got that, after you finish urinating, when you think you're done, you wear your pants and you go out of the toilet, you see that urine is still dribbling. Then you might even soil your pants. That is what is called dribbling. So those are some of the symptoms of prostate cancer. When you get any of these, just suspect you might actually be suffering from prostate cancer. So when you get these pressure symptoms, they are mainly because the urethra is being impacted or is being pressed down by the prostate gland. That's why you get all these symptoms. Some people actually suffer from what is called hematuria. Hematuria is blood in the urine. When you pass urine, you see streaks of blood. At times, the blood won't be visible. You actually have to take the urine to the lab for you to make a diagnosis of hematuria to see that there's actually blood in the urine. So those are the main symptoms of prostate cancer. There's another condition called BPH, or benign prostatic hyperplasia. This is enlargement of the prostate gland without it necessarily being cancerous. So you might get BPH, or enlargement of the prostate gland, giving you similar symptoms to the ones that I gave you. But usually with BPH, the symptoms are milder compared to prostate cancer. And also chances of you getting hematuria are very limited. It's highly unlikely that you get urine in your blood when you've got BPH. And BPH only usually affects younger patients, usually less than 45 years of age. It's rare for you to get cancer before 45. So when you've got these symptoms and you're under 45, it's highly unlikely to be cancer. It's most likely benign prostatic hypertrophy. So what you need is to go and see your doctor and get screening. Now let's get to the screening tests that are done for prostate cancer. Mainly the tests that are done for prostate cancer are: one, what is called a PSA, prostate-specific antigen. This is a laboratory test. It's a blood test that is done. We take blood from you, we take a specimen of blood from you, then we send it to the lab, and then we look at the levels of PSA. Generally, the levels should be between 0 and 4. If it's above 4, between 4 and 20, we say most likely it's benign prostatic hypertrophy. It's not cancerous. If it's above 20, the chance of it being cancer are now increased. So that's what we use. We say for men with high risk of prostate cancer, they should get screening at least, say, once in 2 to 5 years. So you get screening every 2 to 5 years. Once you get screening, then you get to know if you've got prostate cancer. If we screen you and then we diagnose you of prostate cancer at an early age, your prognosis is actually better and it's actually good compared to someone who develops prostate cancer and seeks treatment late, and they come to present to the hospital and the cancer is already spread. Then 2, also do imaging studies. The imaging studies that we normally do: 1, we do a simple ultrasound scan. An ultrasound scan will tell us the size of the prostate. The normal size of the prostate gland is about 20 grams and about 3 centimeters in the largest diameter. If it has grown beyond the 3 centimeters, if it has grown beyond 20 grams, and also it's about 20 mils in 20 cubic centimeters in volume. If it has grown beyond that, chances are it's now enlarged. In fact, it will be enlarged, and it could be benign prostatic hypertrophy, or it could be cancer of the prostate. So when you do these imaging studies and you see that the cancer is grown, then most likely you're suffering from BPH or cancer of the prostate. For now, let's take a short break and come back and discuss the staging and the management of prostate cancer. Welcome back to the third segment of Dr. Joe. Today we're discussing prostate cancer. We've seen what exactly is prostate cancer, where is the prostate gland, what are the functions of the prostate gland, what are the signs and symptoms of prostate cancer. We've also looked a bit at benign prostatic hypertrophy. Now we want to get to make a diagnosis of prostate cancer. The gold standard for making a diagnosis of prostate cancer is by tissue biopsy. Tissue biopsy, like we said when we discussed the cervical cancer and breast cancer, is whereby you take a sample from the tissue, from the prostate tissue, then you send it to the lab. When you send it to the lab, The lab will look at it, the pathologist will look at the sample on the microscope, and they will tell you the cells that they are seeing there. Then they will tell you if the cells are cancerous or they are not cancerous. If they are cancerous, then we make a diagnosis of prostatic cancer. If they're not cancerous and the prostate gland is enlarged, it's most likely benign prostatic hypertrophy. And the other thing that we also do, these ones are not diagnostic. The biopsy is the one that is 100% diagnostic. Before we do a biopsy, we normally do what is called a digital rectal examination, DRE. When you do a DRE, I put my finger through the anus and I feel for the prostate gland. I can feel the texture of the prostate gland. I can feel the size of the prostate gland. If the texture has changed, maybe it's now feeling hard, it's now having nodules, it's not smooth, and it's also enlarged, chances are you're suffering from prostate cancer. So it is at that point in time when you do the DRE that we might need to do a biopsy, and it is the biopsy that is going to help us make the diagnosis. Then on top of that, we need to stage the cancer. By staging, we want to see at what level is it. Normally we stage it from stage 1 to stage 4. We stage it by doing radiological investigations. 1, we do ultrasound scan, then 2, we do CT scans or MRI scans of the pelvis and the femur and the hip joint. So those are the MRI scan requests that we normally do. Then we might also do what is called a bone scan to see if there is metastasis to bone, because prostate cancer has a tendency to spread to bone. So now that we've staged our cancer from stage 1 to stage 4, stage 1 is the one that is milder. Usually the size of the tumor is very small, maybe a centimeter or less, and it doesn't involve the capsule. Stage 2 is now a bit bigger, and it's also not involving the capsule. Stage 3, it's way bigger, maybe 5 centimeters or so, and now it's also encroaching the capsule. Stage 4, it has definitely breached the capsule. Then on top of the size of the tumor, we also look at the lymph nodes. How many lymph nodes have been affected? The higher the number of lymph nodes affected, it means the cancer has also spread, and it also means the grading is now worse and the prognosis is now poor. And if there is distant metastasis, that is, it has spread to organs beyond the prostate gland itself, it's already stage 4 because there is distant metastasis. Usually the sites of distant metastasis where the cancer spreads to is organs in the pelvis. It can go to lymph nodes, it can go to the bones, the iliac bone, that is the hip bone, it can go to the femur, it can go to the hip. That's where it normally goes to. It can even go to the chest. It can go to the liver. When you got distant metastasis, your prognosis is poor. Your chance of survival are also reduced when it's now spread beyond the prostate gland. That's why we encourage that you get screening early and you get treatment early. When it comes now to the treatment modalities, the treatment modalities are mainly 1, surgical resection. If it's still small, we do surgical resection and we remove the prostate gland. Then you survive without the cancer and you live well. 2, you can do chemo or radiotherapy. When you do those, at times you do them after the surgery to help the surgery. At times we've got patients that are terminally ill that they can't withstand surgery, and probably they could withstand chemotherapy or something. Then you could just do chemotherapy instead of surgery first. And then lastly, there are hormonal changes there are hormones that affect the prostate gland. Testosterone is the major hormone that affects the prostate gland. So at times we do orchidectomy. Orchidectomy is otherwise known as castration. We remove the testicles because they're the ones that produce the testosterone that feeds the prostate gland. So when you remove the testicles, we cut off the supply of the testosterone. Then some prostate cancers actually respond better to that effect. And you can also give you some drugs like finasteride that help in suppressing the growth of the tumor to developing into a cancer. So those are the main treatment modalities of prostate cancer. Now to recap the major things. 1, remember prostate cancer only affects males. It affects the prostate gland. 2, remember the signs and symptoms of prostate cancer. If you find yourself having what we call hesitancy, if it takes you time for the urine to come out and you go to the urinal, it's most likely prostate cancer. When you go to the urinal, the urine is weak, you can't hit the wall, we call it a poor stream, suspect prostate cancer. If you finish urinating, you see streaks of urine still coming out when you think you're done, it's called dribbling, suspect prostate cancer. When you've got these symptoms, please rush and visit a medical practitioner that is near you. Then on top of that, once you see a doctor, I see a number of patients. Actually, I had an elderly patient that I eventually lost. who had prostate cancer. When they came, it was a bit early. Then we offered them surgery, and they refused. By the time they came back asking for surgery, it was already too late. It was already spread, and there was nothing much we could do. And unfortunately, we lost that patient. And those are the cases that we're trying to avoid by educating you. If you go and see your doctor and they say you've got prostate cancer, and they encourage that you go on and get your prostate removed, please comply and do so. Thank you for watching today's episode of Dr. Joe. Remember to like, subscribe, and share. Also remember to like droptv.com. Next week, we're going to be discussing arthritis. Thank you.